Hello guys, it's Unit 2 Part K. Hello guys, today's topic is fetal circulation. Okay, this is face and this is the back of the baby, back side of the head. So the head is like this and here they have eyes, nose and mouth. In the fetal skull there are 5 bones, namely frontal bone, 2 frontal bone, 2 parietal bone, this 2 is known as parietal bone, and 1 occipital bone. Fetal skull has 5 bones, okay? 2 frontal bone, 2 parietal bone and 1 occipital bone. And there are 4 sutures. Sutures are nothing but the thing which joins 2 bone is known as sutures. The place or the joint which joins the 2 bones are known as sutures. This is a suture, this is a suture, this is a suture, because this join 2 bones in one place and this is known as sutures. Okay, there is 1 frontal suture which is present in between 2 frontal bone, and there is 2 coronal sutures. These 2 sutures are known as coronal sutures, and this coronal sutures is present in between frontal bone and parietal bone. Even this is also coronal suture which is present in between frontal bone and parietal bone. And next we have sagittal suture which is present in between 2 parietal bone. Next we have lumboidal suture which is present, 2 lumboidal sutures which is present in between parietal bone and occipital bone. We have totally 4 sutures. Those are frontal suture, parietal suture, sagittal suture, lumboidal suture. These are the 4 sutures which is present in the fetal skull. And next we have 2 fontanelles. These 2 are known as fontanelles. First of all, what is fontanelle? Okay, what is fontanelle? When 2 sutures join together forms fontanelle. Do remember, when 2 bones join together they form suture. When 2 sutures join together they form fontanelle. Okay, so there are 2 fontanelle present in fetal skull. One is anterior and one is posterior. Anterior fontanelle also known as bregma, and the posterior fontanelle which is present in the back of the head also known as lambda. This anterior fontanelle, you can see by the shape itself it is in diamond in shape, whereas the posterior fontanelle it is in triangle in shape. This anterior fontanelle gets joined by 1.5 year. By around from the birth, from around 1.5 year, this fontanelle gets completely closed, completely joined, and this posterior fontanelle gets closed completely by the end of the 1.5 month. This anterior fontanelle consists of fontanelle sutures, coronal suture and sagittal suture. This one fontanelle, anterior fontanelle, consists of 3 sutures. Actually these 2 are one nothing but coronal suture, this is sagittal suture and this is frontal suture. And next if you see at the back side, that is posterior part, this consists of 2 sutures, that is nothing but lambdoidal suture, 2 lambdoidal suture and 1 coronal suture. This is very important. If you see its length is around 3 to 4 centimeter and its wide is around 1.5 to 2 centimeter. Its length is around 3 to 4 centimeter and its wider is around 1.5 to 2 centimeter. And this is about the fontanelles. I will provide questions after completing this whole chapter. That's it for today guys. Let's meet in the next video. Until then, stay tuned.